Did you do the note yet?
Oh, hey man, can you go see the new one?
There's a red one on the board. Make it unread.
If it's not written, didn't happen.
I know the patient was here for shortness of breath, but did you notice that small rash on the back of the right ankle and document that in your physical exam?
Once I did something and I didn't write it down, and it didn't happen.
I'm gonna go to the bathroom.
Okay, yeah, just make sure you document that.
Another time I did something else, I did another thing, I did not write that down, that also didn't happen.
I'm gonna go grab a bite to eat.
Yeah, you just gotta remember to document that stuff, okay? It's really important.
I don't want to go back to the chart and have that not there in 2 days.
You gotta remember to document that stuff when you get out in the real world practice. It's really gonna matter, okay? Just so you know.
So, could you get those outside hospital records for that study that was done last year for this patient?
So I have this 42-year-old.
Wait, hold on.
You guys are all so good at the computer.
Okay.
42-year-old guy who has a history of hypertension, hyperlipidemia.
Hold on.
Yeah, computer desk? Yes. Well, my computer. Well, no, it was working like that a week ago. No, I'm telling you, there was just one button, and I would click it, and my whole chart would write. Yeah, it would write itself.
Here with chest pain. The pain started.
Hold on, too fast. Let me type.
I'm telling you what it was like 1 week ago. Well, no, I haven't worked since a week ago, so I don't know. I can't imagine anyone here works more than a few days a week. How would they know?
I was reading through the chart, and you said the respiratory rate was normal. He was breathing at 20.
You know, he's had to be on nasal cannula the whole time he's been here. Can you just check in with ICU before we send him to the floor?
Does this patient have a PCP? Can you go check with them? And could you give him a call too?
Hey, give surgery a quick ring for 7. Just put it on their radar. He's coming in. He's got belly pain. I know we don't have anything back yet.
I see this patient had surgery here about 5 years ago. Maybe we should just call our surgeon and give him a heads up.
Yeah, I saw his belly as he was being wheeled in here in the department. Just call surgery.
Why don't you put it on the old riddery-doo-dah, you know?
Hey, I need to kick you off this computer. I need to use it now. Where I trained was like really county.
It was county both ways, to and from work.
Yeah, sure, it's a community facility, but where I trained, nobody would do that.
Okay, we've pre-oxygenated. I have the patient ready. We've pushed the sucks and the etomidate, starting intubation.
You wouldn't get away with that in my institution.
Now you're in charge of this, so tell me what you see.
No, I
Tell me what
can't.
you see.
I can't see
I want
anything
you
yet.
just
give me a
pretend
sec.
you're practicing solo. What do you see? What do you see? What
So
do
I
you
see
see?
tongue.
What do you see? What do you see?
What are you seeing here?
I have a
What are you
grade
seeing?
1 view of the
All right,
chords.
just let me give it a shot. I don't know that you had the view there.
Subclavian. Now this is what it was like back in my day. We would put lines anywhere. Once I had a trauma, right in the heart. That was the best line.
Wire in the left hand, thread with the right hand.
Now keep your hand on your wire. Keep just good. Just wire. Can you just keep both hands on the wire? Now this is taking too long. Now when you're out there alone or maybe in a county, you can't take 8 minutes to do a line.
I'm gonna go do an ABG on this patient.
How comfortable are you with those? Have you done a lot of them?
It's 230.
Alright, why don't you get yourself ready and then I'll be in a few minutes to supervise.
Now, this has got to be a crash chest tube, so don't prep too much. You gotta prep. Did you prep? Are your preps taking too long? Are you over the rib? Are you in? Now I had a false tract once, right in the brain. Do you feel the lung? It should feel like lung.
Looks like this guy's here for suicidal ideation. Did you ultrasound him yet? Because, we bill for that now.
My resident called you 3 times. It's been 8 minutes. Why are you not in the department?
I know that child did not have a fever and did not have any ear pain, but did you think their TM was maybe a little bit red?
Hey, do you mind doing that hemocult? He passed out earlier. She said she was tired. Really, really like heavy coughing, you know? His anemia, I know it's the same. He said he had a headache and, you know, I just like to be sure. Just do the rectal.
The girl is of childbearing age. Let's do the pelvic exam.
There's no rectal documented, and she didn't remember looking at her stools recently.
Why don't you see if GL will just come down and scope them?
Derek,
Man, I just got off 2 weeks of vacation. I am freaking tired.
Eric, Daniel,
I feel like I haven't had a day off in like 2 days.
Nolan, Ron,
2 baseball games, 2 shifts in 1 week. I have no free time.
Josh,
I hear a little crackles. Did you get the crackles? Can we just do the PE study?
It's a normal S1, S2.
We're gonna get the PE study.
we've been waiting 7 minutes now for that chemistry panel. Could you just go ahead and call the lab, see where it is in process?
It sounds clear to auscultation bilaterally.
PE.
I just talked to the family to discharge them. They'd actually like to change the pharmacy for their medications. So could you change the pharmacy in the computer, reorder the discharge medications, and call the old pharmacy and make sure you cancel the prescriptions that were sent there?
Go ahead and send the trope on him. I know they're 22, but I had an MI and the kid was like 3. I know he got cath yesterday and he had a treadmill a week ago. Let's just roll him out. Go ahead and send the trope on him. He's 32, but you know, I had this 32-month-old patient that had ACS. I had a patient that went to the cath lab 2 minutes after they were born.
Well, if you read the American Heart Association guidelines, a rule out should be 3 days.
5 troponins,
6 troponins.
7 troponins.
22,000 troponins.
I got an 81-year-old female.
Yeah, just admit her. You know, she's 81, you said? Yeah, like 90% of those people get admitted. Just admit her. It's fine. Just call medicine. No matter what.
Now, I understand that this patient came in for a complaint of excess sweating of the buttocks, but something about him just smells like Admit. No, it's not the buttock sweat.
Got a 95-year-old female with an ankle sprain.
Just admit her. Just admit her.
You gotta admit.
Calvin, the sodium on this patient's 134. What's your plan for that?
Did you see the WBCs?
You might have to make a few phone calls for this one.
Well, where I trained, this would have been an admit.
No matter what, they're not appropriate for OBS. Okay? You gotta admit them.
Hey, my attending won't put him in OBS. Alright. They won't put him in OBS.
No, they're not appropriate for OBS. Here, let me talk to him. Come on. Yeah, hi. Yeah. Yeah. Uh-huh. Oh, alright, we'll just put him in OBS then. Thanks.
Where I trained, this would have been an admit. No, I don't care that you're the computer help desk. When I call, you admit the patient.
Alright, so it's recording. So, if you type, don't stare at the camera, Alex. Alright. I got 30 minutes left before I have to run out to my car.
Okay, that's all about all I got.
Do you want to throw on some scrubs?
Sure.
Alright.
I'll go, wait,
Do you have scrubs?
I'll go find scripts.
Alright. We'll keep doing some.
So annoying. So annoying. So annoying. Shut up. Useless, time consuming work.
We put the butt, the buttock line, let me keep going. Buttock, saphenous, PE.
How'd you do it?
Okay, I'm fine. I'm fine. No, I'm good. Okay, we're good. I'm totally getting at it.
Alright.
We're gonna get the PE study.
So
sorry.
every
Okay.
time.
I'm sorry. Okay. Okay. That
I didn't see that one
good.
coming.
Okay, that was good.
Let's redo both.
That,
those,
that's
redo
same
both
thing. That's
those.
good. Okay.
Good. The part of the problem is I realize when we do it righty and
Yeah, we just get it so
it
quick.
doesn't
And
work like this. You know. So anyway.
it's a laryngoscope. You put it in the mouth and you intubate the
Why
patient.
was I doing that right? All right, let's do this again.
You look quite good that way. Thank you. Thank you. Keep that look. I think so too.